Thank you, Jessica, and it's a big privilege for me to be here with Derek and Abbas and Kgosi. I'm a specialist family physician, so a big part of my life was devoted to individual health and helping patients, which was a joy. And then I worked with the World Medical Association and have been involved in tobacco control for decades. So I also worked in population health. Just as a mea culpa, when Derek was working at the WHO and I was working as the Secretary General of the World Medical, we were actually part of the public health environment who failed to make a good distinction between combustible tobacco and smoke-free options. I remember in 1999 when we campaigned for the World No Tobacco Day, we still were saying that all tobacco kills, don't be duped. And as a big mea culpa now, we realize that this lack of differentiation is a big issue. And perhaps then just to answer your question, Jessica, perhaps it will be useful to look at the most important threats and the most important opportunities leading up to COP10 starting on Monday next week. So the biggest threat from your question in terms of regulation, innovation, technology leading up to COP10 is really, number one, the lack of engagement, and number two, the lack of differentiation. Exactly what I've been referring to and where I was guilty of this malady myself. What do I mean in terms of lack of engagement? Well, the United Nations high-level meeting on the prevention and control of non-communicable disease, which focuses almost mainly on tobacco-related disease, calls for what they call multi-stakeholder engagement and multi-sector action. Now, the WHO, as one of the agencies of the UN, has ascribed to this principle. But if you look at next week's COP10, it's very clear that most of the private sector has been excluded from COP10, which is in stark contrast with what happened at COP28. I think Derek very eloquently mentioned that during COP28, all the stakeholders had a seat at the table, including non-state actors like the private sector. And that helped to give an inclusive debate where there was ownership of a societal problem. And this is badly needed within tobacco and tobacco control and harm reduction. So it is extremely important that especially Article 5.3 is not incoherently applied. And I'll give you an example. WHO, through Article 5.3, has excluded most of the big private tobacco and nicotine manufacturers. And bear in mind that not all nicotine manufacturers have anything to do with tobacco. But inside the whole, you have big countries that have significant stakes in their own tobacco companies, and they are completely part of the policymaking process. China, for instance, the government owns 100% of the Chinese National Tobacco Corporation, and that company is responsible for the manufacture of 60% of cigarette sticks that are consumed per year. So you have an incoherent and inconsistent application of the Article 5.3, which at heart was to try and exclude or to make sure that there would be no interference in policy making. What should be done is that there should be multi-stakeholder engagement, because engagement does not mean agreement. It means an inclusive debate. And more importantly, it helps to bring the right science from all the different sectors to the table. The second is what Derek also mentioned, the lack of differentiation. If WHO in the oral health strategy does not make a distinction between snus, which is an oral tobacco pouch, and oral nicotine, which is non-tobacco but nicotine only, this is a grave error where precision is necessary, because it involves people where you need to give accurate healthcare information. So this lack of engagement and lack of differentiation will make a big impact on the quality of decision making and ultimately policy making next week. Then what would be the biggest opportunity for next week? And my colleagues have already mentioned a few. If you have a treaty which is at this stage more focused on process than actual outcomes, you will always have a neutral to negative result. Whereas if the treaty would look at best practice throughout the world and then make sure that those practices are studied, make sure that all member states have access to the kind of evidence that is used in those countries, and then to replicate or at least emulate that in their countries, then we can have progress. So for instance, in Sweden, we have a country where there is a smoking prevalence of 5.6%. This is an extraordinary achievement. In essence, it's a smoke-free country. How did they do that? They linked tobacco control with harm reduction strategies and products. If you look at another category like heated tobacco, Japan has over the last 4 years managed to facilitate the conversion of cigarette smokers to heated tobacco products which are not combustible in about 40% of the smoking prevalence. So this makes a big difference, and you would imagine that WHO would be first to analyze what was done right, what was done wrong, and make sure that this technical advice is shared throughout the 194 member states of WHO. Likewise, in the vaping category, you have countries like the UK, where the government has fully embraced tobacco harm reduction. There's the big debate about modern disposables, but in essence, they've embraced harm reduction, and likewise New Zealand. So here you have 3 categories where a fire escape has been developed for the smokers in those countries. Tobacco control has been linked with and facilitated and empowered by harm reduction strategies, and that has caused a better outcome for individual health, for population health, and this is exactly where the opportunity is for WHO to take leadership. Make sure that, as they did with the COVID vaccine, that member states receive the most updated evidence and make sure that their policy making is based on evidence and not on ideology. So that, in answer to your question, is probably the most important threats and opportunity for next week.
Thank you very much, Delon. Just a quick question regarding oral health. Do you think the WHO gives enough attention to harm reduction strategies in oral health? And if not, why do you think this is?
Jessica, firstly, WHO did publish the oral health strategy in 2022, which is a big step forward because at least it raises awareness and it helps the 1 million dentists throughout the world engage better with their patients and their governments with the oral health issues in their countries. But if you look at the big burden of disease of oral cancer in those countries where smokeless tobacco is used in the mouth, as in Southeast Asia, it's another opportunity lost, where WHO could have brought in the differentiation between the various products, tobacco and nicotine products, which are used in different areas of the world, and they could have made a much better effort to identify, quantify, and help replicate the correct message to those countries where oral health issues, and specifically cancer, is at the order of the day. So the WHO report on oral health is a start, but unfortunately, as with the Framework Convention treaty, they've missed the opportunity of a clear differentiation between harm-reduced products and pure tobacco products. And there, much more needs to be done to not only save lives, but to make sure that people have cleaner teeth, whiter teeth, a more healthy oral cavity, and that the low-hanging fruit of harm reduction can be taken on board very quickly. And actually, oral health is one of those areas where if today all smokers were to change to oral nicotine pouches, you would have a different oral health environment tomorrow.
Thank you very much.